Pennsylvania. I'll tell you a little bit about what we do at the end. But we're here for you. Our mission is to provide programs and services for anyone affected by Parkinson's. Family, friends, individuals with Parkinson's, professionals. And thank you, Dale, for facilitating this wonderful support group in Cranberry. And I'm going to get started. So I think we got this figured out. Okay, so I have handouts for all of you so that you can take those home with you. Don't read ahead, there's a quiz. Just kidding. That's always like that joke. But laughter is always good for fatigue as well. So I just included this slide because I just wanted to kind of give you a quick overview of usually what brings you to the doctor to get a diagnosis of Parkinson's. They're called the motor symptoms, so the physical symptoms. So usually people might have a resting tremor on one side. The movements become very slow. You become very stiff and rigid. So 2 to 3 of those cardinal motor symptoms, as they call them, are required for a diagnosis of Parkinson's disease. And then there's a lot of secondary motor symptoms, which you might be aware of. The freezing, the small handwriting, for instance. Some people have the stoop posture, swallowing and speech problems. There are many, but I just wanted to kind of give you that overview of the motor symptoms. And often the motor symptoms, if you think of an iceberg, those are the tip of the iceberg. And then there's a lot of non-motor symptoms. So this next slide is very extensive. That's why it's so small, fit everything. But keep in mind, you won't experience, just like the motor symptoms, you're not going to experience all of those. Nor will you have all of the non-motor symptoms. And today we're going to focus on, as you can see here, the sleep disorders. So those are one of the categories of the non-motor symptoms. And then the other one that we'll focus on today is fatigue up there. So that, because they're related, but they're not the same. So I think it's a good time to talk about both. Because sleep problems can be an issue for people with Parkinson's. Often that could be a precursor. You may have had these sleep problems for 8 to 10 years prior to Parkinson's. And fatigue is often one of those symptoms that is really problematic. Often people report fatigue and apathy, that lack of just, you kind of feel blah, and you just don't have a lot of motivation as some of the most problematic symptoms of Parkinson's. So we're going to talk a little bit about fatigue and the sleep problems and some of the techniques that can help. And you're already doing one. Most of you, were in an exercise class, or maybe you're doing exercise elsewhere. But that can really help combat both of those issues. So this is just a little overview, basically indicating that sleep problems are quite problematic for someone with Parkinson's. We're going to talk about the different types. And it's sleep in general is such a predictor of how you do in life, right? So just kind of thinking about if you're sleep deprived, it can really affect your cognition, your performance, your focus.
Your mood.
Yes, your mood, absolutely. And your immune system. So sleep is so important for anyone, especially if you have Parkinson's. And then these are just kind of more persistent problems, like you were saying, mood, erratic behavior, hallucinations. This is when sleep is really an issue. Death, that's very rare. But I guess the whole premise is that sleep is really important. And, it's important to look at, maybe you do have depression, or maybe your mood is due to not getting enough sleep, or maybe it's both. But it's important to look at what sleep might affect. So if you can get your sleep better managed, it can help some of those other issues to be minimized. So just, and if you have questions at all during this time, just raise your hand. I'm glad to answer them at any time. So these are the 4 main categories of sleep issues associated with Parkinson's. The insomnia, so that's going to be the difficulty staying asleep, also falling asleep, or maybe you're waking up quite a bit. So that can be an issue with Parkinson's. We'll start there. And then there's some movement issues that can occur when you're sleeping, motor disturbances that affect sleep. Some people may experience some confusion, hallucinations, behavioral problems like acting out dreams. That can be an issue. And then we'll talk about excessive daytime sleepiness. And then we'll talk about some of the ways to manage these, and then we'll talk about fatigue. So I already kind of shared insomnia. I think most of you are probably aware. Oh, also the early morning awakening. Does anyone experience insomnia? Okay.
Not insomnia, the early morning awakening.
Right, which is...
I'm waking up at 7 a.m. and I never did that even when I worked.
Okay. Okay. So you're waking up.
Awakening.
Yeah.
I'm good. I just retired a week ago.
Oh, well, congratulations.
And now, with a stressful job, but again, I slept pretty much normal. Now, I'm waking up at 3 o'clock in the morning. You can't get back to sleep. And it's a non-pressurized situation now. It seems reversed. So I just throw that out if there's any thoughts you would have on that.
So you're waking up early.
Yeah.
And is it difficult to fall back asleep?
I try to read or do something to make myself tired. Read something technical or whatever that would make me tired, and maybe an hour later I fall back asleep.
I mean, that could be due to the Parkinson's. I mean, I'm not, certainly not making any kind of diagnoses or anything. Or maybe you're adjusting, like, to not working, because that's stressful. I mean, retirement can be stressful in itself, because you're in a new phase in your life. So, I guess just kind of keep an eye on that for now. But sometimes reading can be stimulating, but if it's a book, that might be helpful. So that's interesting. Does anyone else experience waking up early and not being able to fall back asleep? Don.
3 o'clock in the morning.
Okay.
3 or 4. Sometimes 4 or
3 or 4.
It's time to get up and get dressed and get breakfast. No, it's not.
Okay.
Go back to food. He really can't. He doesn't.
If you go to sleep,
He tries, but he can't. It makes it worse if he lays back down and tries to get back to sleep, so.
If you lay back down, do you eventually fall back asleep?
Do you eventually fall back to sleep if you lay back down?
Not really.
Okay.
It's all the turn.
So we can look at some, strategies. I don't know when you go to sleep.
If you turn in, like, sometimes I turn in at 8 o'clock at night, wake up 4:30 or 5 in the morning, and stay up, is that considered, I'm not depriving myself of sleep, I'm getting 8-9 hours,
No, is that your regular schedule?
pretty much.
That seems pretty normal. I think, like, one of the ideas is to keep a regular schedule. So if you're getting sleepy at 8 and you sleep until about 4:30, I mean, they say 7-8 hours of sleep is good.
Yeah.
So maybe that's just your, what is it, circadian rhythm? So the insomnia can be an issue, as we've just talked about. So that can be due to the movement disorder, Parkinson's, for instance. Also medication, because some of you might not be taking any type of dopamine replacement, like carbidopa levodopa at night because you're sleeping. But some people find if there's an extended release carbidopa levodopa that lasts throughout the night, that can help with sleep. Because dopamine, you have lower dopamine, right? Because of Parkinson's, and more dopamine helps with a better quality of sleep. It's not the only predictor, but. So for some, medication can be tweaked or added at night or a different formulation. Also, depression and anxiety could be affecting your sleep. That could be something outside of Parkinson's. And then it's always good to rule out sleep apnea. So if, there's a lot of wake up, it's recommended to go, talk to your doctor to get some type of sleep study, because it might not be related to Parkinson's. So that's something to think about. And moving on to the nighttime motor disturbances. Some people, because you're stiff due to Parkinson's, that might cause some of the wake ups. You're not comfortable. Dyskinesia, which is the involuntary movements, that's usually when you have too much carbidopa, levodopa. If you have, those are those involuntary movements, so that means the medication might need to be changed. That can affect your sleep. Tremor, some people do have tremor at night. For some, the tremor like subsides or like lessens at night. But tremor can affect your sleep. Anyone have any of these concerns at night? You don't. Remind me of your name. Did you raise your hand? The Paul look-alike. Sorry. You look like a brother. Do you have trouble with any of these?
Yeah.
Okay. Remind me of your first name.
Bob.
Bob. Thank you. I know faces, but sometimes it's forget the names.
And RLS is a problem sometimes for me.
Which one?
RLS,
Oh yeah, we're perfect. The restless leg syndrome.
you get it, you can't get rid of it that whole night.
Yeah. Is it like? Yeah, the restless leg syndrome is. Anyone? Are you familiar with? I mean, probably have heard commercials, but and I know there's medication that can help with that. But restless leg syndrome can be a part of Parkinson's, and it's also one of those possible early signs. Not for everybody, but you really. I mean, can you explain it? Just in your
It's like, you can't get comfortable, it's there.
like you're restless in your legs, right? So that would be something to talk to your doctor about, because does that affect your sleep?
Yes, it does.
Mark, it's Mark, right?
Yes.
Okay, Mark. So restless leg syndrome could be an issue. Periodic limb movements. So we've all probably experienced this from time to time when you're about to fall asleep and your leg might you might kick it or think you're falling. But for people with Parkinson's, this can happen more frequently, which can affect your sleep. And then the last one that I'll talk about in this nighttime motor disturbances category is rapid eye movement sleep disorder. So has everyone heard of REM sleep? The sleep cycle when you're dreaming? People with Parkinson's, they don't exactly know why. I'm sure it's due to dopamine. But when, say, a person that doesn't have Parkinson's is in that REM, that dream state, you're temporarily paralyzed. But for people with Parkinson's, that's not happening. So you actually could be acting out your dream. Like you could be like thrashing your arms. Some people get out of bed. Sometimes people have to sleep in separate beds. So that's disruptive to your sleep. And could be your partner's sleep. Charlotte, did you?
Oh, he's done that before too.
Okay. So that can happen. And another possible early sign of Parkinson's. And sometimes people will also like yell and scream. I mean, there could also be like verbally acting out, not just physically. So these are some of the nighttime motor disturbances that may occur with Parkinson's. And then moving on to some of the hallucinations and behavior problems. Sometimes later on in Parkinson's, people may develop hallucinations. Sometimes they become more problematic at night, like that sundowner. Sometimes people with dementia can have the sundowner issue, but you might have more confusion, agitation, pacing, just like overall agitation. So this can affect sleep, and it's just something that can occur later on in Parkinson's, but not for everybody. If anyone, this is not exactly, it's related to a degree. Hallucinations can be part of Parkinson's. If it's earlier on in the diagnosis, it's usually due to medication, because dopamine is a feel-good chemical, but too much of it can cause some of these positive symptoms, like thinking there's somebody, seeing something or hearing something, or thinking something that's not correct. So just wanted to mention that to you. And this next one falls in this category too, but we already talked about it. The rapid eye movement, the REM behavior disorder, because it's motor, but it's also behavior, because sometimes people are saying things or getting out of bed and moving, so that can be an issue. So there's not great treatments for some of these, but sometimes medications need to be changed. Is anyone taking like some type of, not that we're gonna talk about like specific medication, but like an extended release? Carbidopa, levodopa, okay. Do you take that at night?
Cinematic for, yeah, from bedtime to waking up.
Okay,
It's called a controlled release.
it's not controlled, so it like lasts longer.
Yeah.
Have you noticed any difference with sleep?
No, I can't sleep. I haven't slept for years. I have a traumatic brain injury, and ever since then, my system got all screwed up.
Okay. Do you take that too, Bob?
Yeah, I think it does help some,
Mm-hmm.
it certainly hasn't stopped it.
Yeah, there's unfortunately not a magic pill, but that could be something to consider. We talked about that. And then the last category of sleep issues with Parkinson's is daytime sleepiness. So, yes, that could be due to not getting enough sleep at night. Also, some people have an inverted sleep cycle in which I'm trying to think of how to explain this, but their sleep cycle, like, I don't know, it's changed, so therefore, some of that REM sleep, that's really that restorative sleep, that makes you feel more recharged, could be a lot shorter in the night, so you're not getting that fulfilling sleep. So even though you might be sleeping for 7 or 8 hours, you might not feel refreshed when you wake up. So that can happen due to Parkinson's. And then sometimes, so some of the medications can help with sleep, but then sometimes, I know like the dopamine agonists, I think, some of the medications you're taking can make you more sleepy during the day. Anyone experience that? So that could be a problem too. And just to mention, some people experience sleep attacks. Oh, if you're taking a dopamine agonist in particular, like Mirapex or Requip, some people experience this time where they just like suddenly fall asleep. Anyone experience that? Okay. But that could happen. Sleep attacks. So if that would happen, definitely address that with your doctor. I say that because medication is everything, as you know. Exercise, physical therapy, speech therapy. But for some of these issues, medication needs to be tweaked because you have to find the right dosage, and it changes a lot. So, how can you improve your sleep hygiene? Basically ways to help sleep better. Trying to have that regular time when you go to sleep and wake up in the morning is one. Avoiding daytime naps or trying to keep them short, like 15, 20 minutes. Because if you go into a longer sleep, you get into a deeper sleep, it's harder to wake up, and also that affects your sleep time at night. So really trying to avoid or minimize naps. Using bed for sleep, so it's not a place for entertainment, it's not a place to watch TV. Really, you want your room to be dark and cooler and quiet, and not stimulating. I don't know. I know a lot of people have TVs in their bedroom. It's not the best, or at least turning it off like a half an hour to an hour before you go to sleep, because that's stimulating. Relaxation techniques. Also, if you're awake, trying to, I don't know, there's like mixed thoughts, like 5 to 10 minutes, trying to then go maybe like into the living room, onto the couch, because you don't want to just lay there and toss and turn. It's usually a little bit counterproductive. We talked about environment, and also avoiding, it's kind of trying to avoid stimulating activities. At least half an hour to an hour before bed. If it's stimulants like caffeine, I would say many hours before that. Also to avoid large evening meals, because your body has having to work really hard and digest that food, which affects your sleep. So, are any of these familiar to you? Have you tried any?
About half of them.
Okay. Have you found any to be helpful or not helpful?
You know, that's, the biggest thing is, I used to eat a lot at night
Okay.
for Parkinson's. And the problem is, early daytime naps, that's a problem. Because, I don't know, I'm not really tired. I just sort of sit there and then, and go on.
That could be hard, but at least trying to minimize the daytime naps.
And my problem is sleep hygiene is, I used to have a pretty stressful job. So a lot of times I go to work, I sort of lay down. After Parkinson's, it's just, okay.
The stress, or
This Parkinson's.
Yeah.
Bad, but-
it is. Let's just say that, right? It's
And
true.
When I was first diagnosed, they diagnosed me with ALS. And then they come back and it's, well, good news and bad news. So what's good news? You don't have ALS. That's good because I'm your kid. And I said, what's bad news? I said, what are you gonna burn? If you can have your choice, ALS or Parkinson, take mine. Sometimes what it does, really, with your partner, with my wife, it can mess up her sleep too. That's what.
Right, it can affect both of you. So stress, you have a lot of stress with your job, which stress in itself can affect sleep. So we talk about some, relaxation techniques, some calming things before bed. And then you had Parkinson's after that, and that can affect sleep because of the dopamine in particular, and the other neurotransmitters.
There's not much in good answers. I go to Dr. Leckleiter. It's difficult. There's many questions and many answers. So I don't know.
It's complicated. And there's some sleep aids that can be prescribed, but usually,
Yeah, they have bad side effects.
wait, there's the melatonin, which is a supplement. I know most of the doctors approve that. Usually sleep aids are like a last resort, because some of them you can't take because of Parkinson's medications, and then sometimes you're groggy the next day. But definitely address it. Thank you for sharing, Tom. And some of the other techniques with the medication, we talked about maybe your medications need to be changed, or a different formulation, like an extended, or maybe you're on a dopamine agonist and you get really sleepy during the day. There's definitely changes to medication that can help. That's not everything, of course, but it's important to know that. And then we talked about some of the self-management techniques, sleep hygiene, calming techniques, non-stimulating activities before bed, also alcohol before bed. I know it can help you to fall asleep, but then usually you wake up. So, you have to live your life, but try to manage the best you can. Exercise. Oh, well, as you probably know, exercise can help with sleep. It can really help. You're not exercising right before bed, but it can certainly help. Hydration can as well. I must have left that off. So this is sleep, and then we're going to talk about fatigue, and there's some overlap, but they're different. So that's why I brought this in as well to the presentation. So fatigue is different. You might be feeling really weak, like out of gas, heavy, but you may have had a good night's sleep. So it's not directly related to the amount of sleep. Some of the neurotransmitters like dopamine affect your energy level. Sometimes, they're looking at stimulants like, I don't know, like an Adderall or something that might be used for ADHD as a possibility. I don't think there's been great results, but we'll talk about that in a minute. But fatigue can be really troublesome. It's like hard to explain, but you just don't feel like doing a whole lot, and you feel like you're out of gas. Maybe you have a ton of bricks on your back. Lack of energy. Feeling exhausted, but not sure why. And then sleep issues, as we talked about, those are directly related to sleep. Oops. So, or could be a medication side effect, or both. So, they're different.
You think though that if you feel a lot of fatigue, you're very tired, that should help your sleep.
Yeah, I mean, there's
It
definitely
doesn't.
overlap, but no, you could be feeling exhausted, but you might not be able to fall asleep.
Right.
You know, it doesn't make sense. So this is, okay, but a lot of people, well, I don't know exactly where these come from, but it's common for Parkinson's, and it is often reported as one of the most problematic symptoms, along with apathy. So you could feel fatigued, exhausted physically, don't feel like moving your body or doing anything or getting out of a chair, but emotionally you might feel fatigued, like you just feel kind of blah, like not depressed, but just emotionally just exhausted, or cognitively, intellectually. Because when you're fatigued, it's hard to think as clearly. So this can apply to not only physical, but emotional and intellectual. And these are just some of the descriptions people have used. Do you ever notice, like, did any of these apply to you? Out of gas, run down, just don't really,
Lay down.
yeah. Sometimes, I'll get there in a minute, but interestingly enough, fatigue isn't necessarily related to a specific stage in Parkinson's. Some people might experience it early, some may experience it later on. Sometimes it's a first symptom. And if you experience it early on, doesn't mean it's necessarily going to get worse, or it's going to be worse than if someone has it later. But overall, it could be problematic. There are some ways that you can manage it too. And then if you have depression, for instance, by Nancy. Nancy said jiggly early. Depression can make fatigue worse. Fatigue can make the depression worse. Keeping that in mind. And then we're going to talk about ways to manage it. So there are ways. I got ahead of the game. I was going to mention exercise. I think it's on here.
Yeah, it is.
Oh, okay. We'll talk about exercise first. I'm going in the reverse order. Keep it. Sometimes like changing things up can help. With exercise, you're feeling fatigued, so you don't feel like exercising, but it could be helpful to try to schedule that exercise during the day that you feel like you have the most energy. So, optimizing that. Hydrating, if you're not drinking enough water, and other hydrating fluids, you might feel more fatigued. And that kind of goes along the lines with nutrition. I mean, trying to maintain a balanced diet. Pacing yourself, so putting more pressure on yourself when you're really fatigued isn't going to make it better. That's why it can be helpful to have things scheduled at certain times of the day when you're feeling a little better, or at least knowing that's when I go to my exercise class, or that's when I go see my friends. So keeping mentally active too, to help with the cognitive fatigue and just being more engaged. So being more engaged socially, physically, and mentally is helpful. We talked about stimulants. I don't think caffeine. Caffeine, if that helps you a little bit. But I also talked about some of the prescriptions, but that would be through a doctor. Like I said, they're looking at some stimulants that could possibly help with fatigue. And then antidepressant therapy. So if you have depression, it's best to address that with your medical provider, and see if there's some type of medication that can help, and possibly some talk therapy too. So fatigue can be really problematic. and talk with your doctor. We already said that, but it can be really problematic. Bring it up with your loved ones, your caregivers, providers, so that you're not feeling alone, and that you could try to work on some techniques. There's no magic pill, but there are some things that you could try. Or maybe you're in a support group, or you're meeting friends and you talk about it. At least maybe there's somebody else that experiences that, and you learn something that might help, or just share can be helpful too. So, the second to last slide, or maybe the third to last, but this is just kind of overall, kind of thinking about Parkinson's. It's more of an art than a science. Yes, there's the medications, but it's really finding what your personal prescription, like your life prescription is. So what works for you? Having that, exercise class 3 days a week, and then, getting together with friends, and you need to find out what works for you. So it is more of an art than a science. Seems like most things are in life, especially Parkinson's. And then I just wanted to touch on what Parkinson Foundation in Western Pennsylvania does, because we're here for you and want you to know. So Parkinson Foundation in Western Pennsylvania, there we are. We're located in Bellevue, but we're available to anyone. Western Pennsylvania, Central, we'll talk to anyone, really. We're the resource. And we're local. We're not Parkinson's Foundation. We're going to change our name at some point. We're not a chapter of Parkinson's Foundation. They do great work. They do more research, but we're our own, so we can do what we want to do. And that is to be there for people like you. And all the programs we have, if there's a fundraising event, everything stays local. So if you know of anyone that has Parkinson's, or you are affected, we're here to help. So we have support groups, exercise classes, have all the information over there, to your left, my right. We have educational webinars. The Talk with the Doctor and the Parkinson's Diner, I think, are pretty amazing programs. Talk with the Doc, Tom mentioned Dr. Licklider. He's a movement disorder specialist once a month, first Thursday at 4:45 p.m., which just happened yesterday, but we record all of these. The Diner is the same thing, but it's by another movement disorder specialist, Dr. Amber Van Laar and her husband, so they're a little more research focused. It's a diner because it's at noon. But these are both through Zoom. They're 1 hour. Anyone can join. You register once, you get the reminder each month. And they're on our YouTube channel, so you can watch past ones. Dr. Licklider just answers any question. If it's a personal question about, I take this medication, he's not going to answer personal, but anything related to Parkinson's, I learn something new every time. And then Dr. Van Laar, her and her husband, they usually have a topic. So that'll be on the third Friday at noon. I was going to see if they'll talk about medications again in the different classes. But if you have certain topics that you're interested in, let me know, because they're very topic specific. And then we have webinars, usually I think we're gonna do 4 to 6 a year. So if there's topics, we'll bring in specialists. That'll be a live session on Zoom. And then we have a webinar coming up on February 7th by John Dean and Josefa Domingos. And they're Parkinson's specialists, and they're going to talk about some of the, I'm trying to think. They did one in November. There was an overview of Parkinson's. It's on our YouTube channel. This one's going to be a little more on self-care strategies. And then, I told you about the Talk with the Docs. We're having a spin-a-thon in February. Stay tuned. March 20th is a Penguins game, a charity game. If you want to go to a game and get a pickleball paddle, look out for emails about all of this. Our big Living Well conference is on Saturday, April 29th, and our big fundraiser community awareness event is in September. We have other stuff too, but that's what we do. And my
Where's
contact.
the Living Well gonna be?
Oh, I'm glad that you mentioned that. So we're moving the Living Well conference around a little bit, so that this year it's at the Hilton Garden Inn South Point. So you're gonna have to go down 79. It's by I think it's before the
Has it
Canonsburg.
been there before?
No.
Okay, then I'm thinking somewhere else.
Yeah. And then the Step Forward Walk is staying at the Shrine Center Picnic Pavilion in Cheswick. We had the conference in the inside part last year, but we're moving the conference. Has anyone heard, speaking of living well, has anyone heard of Jimmy Choi?
Of what?
He was on American Ninja Warrior, Jimmy Choi. He has Parkinson's, and he's a inspirational speaker. He's going to be speaking at our conference. He won, I think he won it one year. And he was not exercising, he was not managing his Parkinson's, and he talks about his journey in self-care and what he did to better manage it. So, then we usually have
You'll let us know where it's at?
yeah, that's the Hilton Garden in South Point, but you'll get information about all
Yeah.
this. And if anyone doesn't receive our emails, let me know, or I'll
I'm not sure if we get it or not.
check your spam folder, but I'll pass around a separate sheet so I can take it with me. Just put your name and your email, and I'll make sure you're on our
They
email
always
list.
get an email for talk with a doctor and I quit getting it.
I think I get it.
You know, I heard that from someone else yesterday.
So,
It might go to spam,
Yeah.
but, we sent, so you didn't get any of the email reminders about it.
not for yesterday's talk.
Okay, I'll check on your email. I'll send around a paper. So that's all that I have. Thank you for your attention. Thanks for being here. Thank you, Dale of MRS. Any questions? Thoughts, comments, feedback? Complaints? I didn't bring your t-shirts.
No,